Coming of Age is coming up next. I'm your host, Emily Echeverria. First today, it's Breast Cancer Awareness Month, so we'll be talking signs, symptoms, and treatments. Next, we'll be checking in with Visit Pensacola to explore the many upcoming fall events in the area that you'll definitely want to check out. Finally, let's relax with a massage, or at least a discussion of the potential benefits of massage therapy for physical wellness and mobility. Stay with us. Coming of Age starts right now. As we age, staying active and connected to community can sometimes become more challenging. But with Council on Aging of West Florida's broad range of home and community-based services, you can stay healthy, independent, and engaged in life. From Meals on Wheels and respite care to senior dining sites and the retreat, we provide the support and connection you need to age your way. Aging is a unique journey for everyone, and we're here to help you meet your needs and thrive while preserving what makes you, you. Since 1972, we've been a trusted advocate for elders and a support system for those who care for them. Now, let's dive into the age-related issues that matter most to you. October is National Breast Cancer Awareness Month. It's a time devoted to educating everyone about breast cancer and the importance of early detection. Today, we have Dr. Sherif Ibrahim, an oncologist with Baptist, with us to discuss the signs, symptoms, and treatments of breast cancer. Thank you for joining us today.
Thank you for having me.
So first of all, tell us a bit about yourself and what brought you to our area.
I'm Sherif Ibrahim. I grew up in Egypt. Went to medical school in Alexandria, Egypt. Went to Arkansas, University of Arkansas for training, internal medicine and hematology oncology fellowship, and then moved to Pensacola after that. I grew up on the beach in Alexandria on the Mediterranean, so gotta get back to the beach.
All right. Well, what are the signs and symptoms that people should be aware of to determine if they could potentially have breast cancer?
So we really would like to detect breast cancer before it causes any signs and symptoms. So I think I would just focus on screening mammogram. This is before even having symptoms or signs. We are trying to detect breast cancer before that. But if we don't, then I encourage every woman to seek diagnosis if she feels anything in her breast that's abnormal. Unfortunately, sometimes we see women who had benign breast lesions in the past and they assume a new lesion is a benign lesion like the old one. It turns out to be a different story with diagnosis of cancer. So if there's any feeling of anything new in the breast or the underarm area, we need to seek medical attention.
Okay. So what are the different types of breast cancer and how do you diagnose it?
So there are really so many types of breast cancer. We talk about breast cancer as one disease, but there are really so many different types with 3 major types. And it all depends on the biopsy and the diagnosis, the pathology from the biopsy that determine what type of breast cancer. The most common type of breast cancer is driven by hormones, so it's hormone receptor positive breast cancer. There's another receptor that we look at called HER2, and this is the second type of breast cancer, HER2 positive breast cancer. And then the last type is triple negative breast cancer, which is negative for the 3 receptors that we test for.
What are some of the traditional treatments for breast cancer?
So really the treatment is mainly surgery, chemotherapy, radiation therapy, and hormone blockers, because again, the most common type of breast cancer feeds on hormone and it's driven by hormones.
What are some of the latest treatments for breast cancer?
So breast cancer has advanced significantly in the last few years. So unfortunately, still about 300,000 women will be diagnosed with breast cancer every year. But the mortality of breast cancer is going down. Unfortunately, we're still losing about 40,000 women every year to breast cancer. But I think the mortality is going down because of the screening program that we are detecting breast cancer at earlier stage that we can cure, but also the advancement in the treatment. So now, beside chemotherapy, we have immune therapy, which are drugs we've used in several types of cancer, but relatively new to breast cancer and definitely improved the prognosis, improved the rate of cure for early stage breast cancer. And we have new drugs that's called ADC, or antibody drug conjugate. These are new drugs. We have already 2 approved right now. This has improved the prognosis in metastatic breast cancer, and now there are so many clinical trials in the early stage breast cancer to try to cure more women with early stage breast cancer.
Well, it's great that there are so many new kind of treatments available.
Absolutely.
I think you gave me this number, but tell me again, how many people are diagnosed each year in the United States with breast cancer?
300,000.
Yeah, okay, so still a huge number. Is there anything done differently to treat men or women with breast cancer? Because I know anyone can get it.
So really, we diagnose about 1 man with breast cancer for every 100 women with breast cancer. So this is just, say, it's still a problem in the diagnosis in men. The surgical treatment is a little bit different. We tend to do more mastectomy, removing the whole breast in a man, just because the breast size is different. And also the hormonal therapy, we don't have all the options that we can use in women as in men, but the chemotherapy part, the radiation therapy part is very similar.
Gotcha. What are healthy behaviors that people can adopt to help them fight against breast cancer?
So really, again, screening and seeking attention if there is any new symptom, anything unusual, even if a woman had a mammogram 6 months ago and that was normal and she feels a new change in her breast, she needs to seek attention and just not rely on a normal mammogram 6 months before that. This is the most important thing. There is healthy lifestyle in general, for reason or another, decrease the chances of breast cancer and even improve the prognosis in women who are diagnosed already with breast cancer. Exercise has a benefit. Eating habits, eating more vegetable and fruit. These are really the habits that can decrease the chance of getting breast cancer, and even with women diagnosed with breast cancer can improve the prognosis.
Okay, so those kind of typical healthy habits that we all know and love. Does Baptist Healthcare offer mammogram assistance to women? And if so, what does make someone qualified for that?
Yes, so actually we have a program that's called Sister for Sister, and there is a mammogram screening on October the 12th, so this is next Saturday, and there is a phone number if any woman can call and just go through a short questionnaire to make sure she qualifies, then she can get the mammogram for free. And the phone number, I have it here, is 448-227-7729.
Great. Thank you so much for this.
You're welcome.
Next up, Visit Pensacola is helping us sort through a jam-packed fall schedule of events around the Gulf Coast. Stay tuned.
Navigating healthcare is hard. Baptist makes it better. With convenient locations, easy scheduling, and skilled, compassionate doctors, all when you need us most. The next time you need care, let Baptist make it better. Baptist Healthcare.
The Reesburg Institute, Pensacola's ear, nose, throat, and voice center. We welcome you to visit us at our convenient Davis Highway location in Pensacola. At the Reesburg Institute, we offer the most advanced treatment available in a calm, stress-free environment. Since 2014, we've performed over 1,000 cases in office of balloon sinus surgery, as well as septoplasty and nasal procedures using oral sedation. The in-office procedures result in a faster healing time. Visit us and feel the difference.
Eyes forward. Don't drive distracted.
Animal Allies is looking for volunteers, and there are many ways that you can help. From taking care of cats to using your computer and social media skills, any and all assistance is greatly appreciated. We have morning and afternoon shifts every day or help at adoption events. You can even foster a kitty at home. And it counts towards community service hours for bright futures. Find Animal Allies Florida on Facebook and Instagram, or go to aaflorida.org/volunteer.
Keeping your family healthy can be complicated. Baptist makes it better with trusted primary care doctors for the whole family and trusted specialists at convenient locations throughout the region ready to care for you. All when you need us most. Let Baptist make it better. Baptist Healthcare.
We have an incredible lineup of fall events and festivals happening right here on the Gulf Coast in the next few months. From the thrilling Homecoming Air Show to the eclectic events of Fufu Fest, there's truly something for everyone to enjoy. We have President and CEO of Visit Pensacola, Darien Schaefer, here to give us an overview and some tips on planning your adventures this season. Thank you for being here.
Oh, thank you for having me.
So first off, tell me a bit about what exactly Visit Pensacola does.
Sure. Well, Visit Pensacola is celebrating its 10th year as an organization, so we're really excited about that. We are the destination marketing organization for Escambia County. 10 years ago, there was a decision by the Board of County Commissioners that said, hey, if we're going to properly market us as a place for attracting visitors to tell our story, it would make sense to pool our resources into one organization to have the strongest voice possible. And so out of that discussion, Visit Pensacola has been formed, and like I said, we're now celebrating 10 years. I'm the president and CEO, and our job is to talk about visiting our county by talking about Pensacola, Pensacola Beach, Perdido Key, and we do that through a multitude of ways. Really our job is to extend that invitation. And inviting people to come here often for the first time, because I run into people all the time that said, I had no idea how great the Pensacola area was and all the things to do. So then the different ways and the different experiences from Perdido Key to downtown Pensacola, out to Pensacola Beach, up in the northern part of the county, so many different things that they wouldn't expect. And so part of our job is if we can get someone here for the very first time, we think we'll have them coming back again and again.
Oh, that's awesome that you've been here 10 years now. To me, it feels like Visit Pensacola has always been here. And I also think of it as where I go to see what's going on around the city for me, but it's also about inviting those outsiders, those people from the region to come on and see what all we have to offer. So fall is a really vibrant time in our area. Tell us some of the bigger events and festivals that are happening around this time.
Yeah, I mean, really, fall is my favorite time of the year. I think it's the combination of great weather, which we are now in. It's we have visitors that come here all the time, but with school back in session, we see fewer visitors than, let's say, during the busy summer months. So now there's less competition for restaurant reservations and parking and those type of things. So it's a great time to get out and about and enjoy your own community. One way to do that is through all the great events that are going on throughout the county. And truly, every weekend there is something going on, and in the month of October it really does kick off, whether you're into food festivals or music. We have cultural festivals as well. So Taste of the Beach is bigger and better out at Pensacola Beach, October 12th, Saturday. And then Pensacola Interstate Fair kicks off, a long-standing tradition. And going to the county fair has always been one of my favorite things to do from when I was a kid. So I think it's a really neat experience that adults can now share with their kids or their grandkids. And you have 10 days. So it's from the 17th through the 27th of October. So you have quite a few days to pick from. Halloween's pretty big in Pensacola. We've got a lot of activities. A popular one is Beach-O-Ween, that is out at Pensacola Beach on Friday, October 18th. And again, a great, safe way to do trick-or-treating with the grandkids. And then if you're into music, the Gulf Coast Summer Jazz Festival is the 18th and 19th, and that is down at Maritime Park. And every year they do a great job of bringing in great jazz music. So that's October. And then we get into November. And boy, the first 2 weeks of November is just jam-packed with opportunities. So whether you like sports, music, cultural arts, let's just go through some of the lists, if that's all right.
Absolutely.
The Great Gulf Coast Arts Festival is at the very beginning, November 1st through the 3rd. And that's a great event. Same time, the Pensacola Greek Festival is also going on. So 2 options that first weekend. But you also have, during the same time, the Blue Angels Homecoming Show. And super special this year, they'll be joined by the Thunderbirds. So this is one not to miss. And they do 2 shows, Friday and Saturday. So make sure you have it on your calendar and get up early to go out and see really a spectacular show. We also have the Frank Brown Singer-Songwriter Festival, which has now gotten to be about 10 days itself. It goes from November 7th through the 17th, and it's at venues throughout the county. Quite a bit of it is done out at Floribama, but there's venues downtown, even out at Pensacola Beach. And it's such a great event where these performers are telling you the background stories behind all these songs, so it really gives its meaning. And so that's, again, 10 great days of options to do that. And even Pensacola Egg Fest on November 10th has become really popular Sunday event.
Awesome. Well, how can people stay up to date on all those events that are going on?
Sure. Well, we think the best way is to go to visitpensacola.com and check out our events page. We encourage all of our area events to enter their event. It's free, and then we turn around and share that with our residents, with our visitors. You know, we talk about our primary role is promoting the county, inviting people to come and visit, but many of the things that we do as an organization are available to our residents, including we operate 2 visitor centers. So the one that's downtown right by the base of the bridge in Wayside Park, and then there's another visitor center out in Perdido Key across from the Perdido Key State Park. We share that with the fire department and the Perdido Key Chamber of Commerce. And there is a 3rd visitor center as well that's out at Pensacola Beach. So that's run by the Pensacola Beach Chamber of Commerce. They do a great job, and we all are sharing information so that if someone's looking for something to do, there definitely is something to do.
Absolutely. And just quickly, what would be any suggestion for something that might be of note for an older adult or someone just looking for like a slower pace?
Well, I think what's great about all of these opportunities is there's a combination of indoor and outdoor. You can do as much or as little of those things as you want. And so I don't think there's anything that would be really, as far as accessibility and an opportunity to enjoy the experience, that would prevent anybody from doing that. And then I almost, I didn't forget, but I want to make sure I get to, we have Fufu Festival. And so Fufu Festival, it's celebrating its 11th year, and every year it's grown and evolved. And again, it goes from October 31st, it kicks off on Halloween, through November 11th. And what's neat about Fufu Fest, it's really designed to showcase off the cultural and arts aspect of our community. And for our size, we have some amazing organizations. And so they can apply for grants to take some of their programming to a much higher level and do some one-off special events. So they might bring in some guest artists, do some special installations. I think if you've been in the Pensacola area for a while, you're pretty familiar with some of the really neat things that they've done through Fufu Festival. And so this year, 13 different organizations got grants. And of course, to learn about that, you can go to visitpensacola.com or fufufestival.com.
All right, thank you so much. And we've got such a variety of events that we're really excited about.
Yeah, so get out, no excuses. Get out and really enjoy the fall.
Stay with us. We're discussing the potential benefits of massage for older adults when we return.
I don't know why you're so sad. You've got a roof over your head.
Bro, you gotta stop with that depression stuff. That's a white people thing.
Escúchame, en esta casa los hombres no lloran.
You alright?
It just feels like it's coming from everywhere.
Do you want to talk about it?
Thanks for hearing me out, bro. Appreciate it.
You can talk to me if you're feeling sad.
Whenever you need to talk, I'm here, okay?
¿Qué color? Perfecto, mijo.
Gracias. Thank you.
What's wrong, mijo?
Donating to a pet's medical care is one of the many ways you can help families in your community. Pets and people belong together. Learn more at petsandpeopletogether.org.
You might think of massage as a luxurious way to relax, but the benefits can go much deeper than stress relief. For older adults, the positive impacts can extend to pain management, improved mobility, and as part of rehabilitation after surgery. Robyn Houghton has spent 31 years in healthcare as a nurse and licensed massage therapist, and she's here to tell us more about the ways massage can improve wellness and quality of life. Thank you for being here today, Robyn.
Thank you for having me.
So first of all, tell me a little bit about your background and how you got into massage therapy.
So I came to nursing school here a really long time ago, and then I worked for the Navy as an ICU nurse overseas in Okinawa at the Naval Hospital there, and then I was at Vanderbilt Children's Hospital for about 20 years. While we were overseas, my spouse at the time had an injury on active duty, and it became disabling. And so we found massage therapy when we were looking for pain management options.
Oh, wow. So what are the benefits of massage and the benefits that might be particular to older adults or people that have suffered an injury or disability?
So one of my favorite things is that massage is going to improve circulation. And so we're going to have improved blood flow to whatever area we're working on, let alone improved blood flow to the brain. We're also going to have improved lymphatic drainage, so we're going to get some of the gunk out of our bodies. We're going to have less stress. It's generally relaxing, or at least moving some of the tissue and the fluid around. So we can aid with healing. We can decrease our stress levels.
And it's always going to be helpful physically to reduce the stress levels.
Oh my gosh,
we know that's
for,
such a
for everybody,
factor.
and all ages, infants all the way up to our very last, days on Earth.
So how can massage therapy benefit the older adults who are struggling with the mobility issues or going through kind of physical therapy post-surgery?
Well, what I like to explain when I'm talking about massage therapy to somebody who's maybe just only used it as relaxation or as like a spa sort of treatment, is what we're going to do is what I'm going to do specifically is I'm going to basically stretch your muscles for you. So our bodies are meant to stretch in the muscles, not the tendons, not the joints. Those are not supposed to be the elastic parts of our body. The muscles are supposed to. So when they are tight or shortened or atrophied, then we're going to pull on the tendons, which are going to pull on the joints and cause some of that pain and that immobility because the stretchy part is not moving. So it's kind of like a yoga session or a stretching session that's passive and generally can be pretty relaxing, more so than going through an hour of yoga, if you will.
So there's some body work along with the kind of like kneading that we think of as massage.
Absolutely.
So how does medical or pain management massage differ from a traditional massage that we think of that we're talking about that is mostly for relaxation?
So for me, if you're coming to my office, the difference is going to be pretty vast. So I think of a spa massage or a relaxation massage being very quiet. The lights are down, the music is soft. So that can be the same in a sports or a pain management or a medical massage. But there's usually very little talking in that kind of a massage. You don't change positions a lot of times. It's more just get the person in so that they can chill out. When we're working on maybe a pre or post surgery or an injury, or we're working on mobility, my goal, especially with my nursing background, is we want to see a change. If you came in for pain management, then we want to get the pain really low. So in that kind of a massage, my primary goal is going to be to interrupt the pain cycle. So say you come at a pain of 8 because you have this terrible back pain. We don't want to do anything else that's going to elevate that pain cycle. So we want to soft music or whatever music actually you relax to, maybe an aromatherapy, and I don't want to do things that increase the pain. So we're going to drop the pain level down. If something is uncomfortable, then we move to something that feels nice for a few minutes. The other thing with like a medical massage is we're going to maybe do some, hey, see how that feels now. Move that around for me. Do you still have some pain in that area? Do you still have some immobility in that area? So it's a lot more interactive massage than maybe a spa massage or a relaxation massage that we may have gotten somewhere else is going to be.
Gotcha. So there's a lot of kind of communication.
There is a lot of communication and assessing and reassessing, trying something new and then seeing how that works.
Yeah, okay. So for seniors that are experiencing chronic pain or limited mobility, how can massage be incorporated into whatever else they're doing with their care plan?
Well, I love it when someone is for massage, an orthopedic surgeon or a primary care doctor or a physical therapist, because there's still not great integration with everybody right now. So when somebody is for it, it's fantastic. I like to be able to be part of a team. I'm happy to talk to the doctors or physical therapists or whatever. I can see clients in my office. I've also can see clients at home, say they don't have the mobility to maybe get on a massage table or get in and out of the car easily. We can do it at home in their recliner or something to that effect. So it's a good addition to the other services that maybe don't spend as much time hands-on.
Sure. Yeah, a very holistic care that it can add
and
to.
A kind of continuity, everybody working together.
Absolutely. So what advice would you give to caregivers who are considering massage therapy for their loved ones but aren't sure if it's safe or appropriate?
I would say that in my opinion it's safe and appropriate for everybody of all ages, and it's definitely worth looking into. If I were to be calling for a caregiver for one of my parents in any form, I would want to make sure they were qualified, that they were experienced and educated, and then that we had some sort of rapport. So it's always a good idea. I think if there's some way to look up the person, online, or for me, you can just give me a text or a call. We can chat through it and see if we're a good fit, because for me, it's a very personal sort of thing. They're gonna, your massage therapist is gonna be touching you, and you're gonna be maybe in their office or maybe in your home, so you wanna make sure that it's somebody who is educated and experienced and that you mesh really well with.
Yeah, I love that. Thank you so much for sharing this with us.
Thank you. Thank you for having me.
And thank you for watching. Until next time, enjoy life. You've earned it.